10 new cases of Omicron variant have now been reported in Delhi. This takes the country's total Omicron cases to 93, and this is also after Delhi reported its highest number of COVID cases in 5 months at 85. So very worrying development. Let's go across to Akshay now for more. And Akshay, give us details. What do we know about these 10 new cases?
Well, Gargi, as far as the latest information is concerned, these 10 new cases have been reported after genome sequencing of 40 samples of a traveler coming from at-risk nation and random sampling as well. However, a breakup has not been given by the hospital, but all of these patients were admitted at NDTV hospital after traveling from these countries, and after they were tested positive, their samples were sent for genome sequencing. Out of 40, 30 have not been tested for Omicron variant, and they have the other variants including Delta. And these 10 patients will be kept in a separate ward, as there have been some arrangements made at the Loknayak Jayaprakash Hospital. So the tally has now reached to 20, but the good news so far as the national capital is concerned is 10 out of these 20 Omicron patients have already been discharged from the hospital because they were tested negative for COVID. However, as you rightly mentioned, that the national capital also is now reporting higher number of cases, and this certainly is a thing to worry. And not just the passengers coming from the at-risk nations or passengers coming from international other nations, they have to be genome sequenced, but the government should now consider, in fact, Gargi, to randomly genome sequence the cases that are being reported in the national capital to see that whether there has been any sort of outbreak of Omicron in the national capital as well, because from what we have seen in countries like UK and other parts of the world, that Omicron does have a very high transmissibility, and that can be a major factor in overburdening the healthcare infrastructure if not checked in time.
All right, and Akshay, just for the viewers, what we do know is that all the passengers who are coming in from high-risk countries, they're the ones who are being tested and then sent to the LNJP hospital if they test positive for COVID, and from their samples are being tested for further genomic sequencing. But as you're pointing out, this is being done solely targeting the travelers, so we don't know about the circulation of the variant in the population at all, because we again need to do more genomic sequencing of the testing that's taking place in Delhi to figure out whether it is indeed there in the population.
Well, of course, genome sequencing largely is happening for the passengers who are coming from at-risk nation where Omicron is being reported. However, as a practice, NCDC and other government agencies have been conducting genome sequencing, but the number and the ratio has been extremely low. So if the government actually has to find out that what exactly is happening as far as the variations in the country are concerned, then they must ramp up the genome sequencing work. You have rightly mentioned that all the passengers who are coming from at-risk nation, they have to go through an RT-PCR test when we are talking about Delhi at the IGI airport. And all those who are testing positive as a precautionary measure, they are being shifted to the LNJP hospital. While they are there, their samples are sent for genome sequencing, and it takes a couple of days for the genome sequencing results to be out, approximately 4 to 5 days. And after that, if tested positive for the Omicron variant, the patients are shifted to a separate ward, and all those who are not testing positive for the Omicron variant, they are shifted to another ward. And after repeated tests and proper treatment, when the patients test negative for COVID, they are then discharged. However, they still have to adhere by quarantine rules, and then they have to get tested again after 8 days to ensure that they are COVID negative and it was not a false alarm.
All right. Thanks so much, Akshay, for joining us with all those details. So 10 more cases of Omicron have been detected in Delhi. Remember, we've been testing the samples of those who have come in from abroad who've tested positive. Those who tested positive are being kept at the LNJP hospital.